This is the Plant Powered Challenge 2022, brought to you by Spectrum Health's Lifestyle Medicine team.
Hello, and welcome to the final session of Spectrum Health's 2022 Plant Powered Challenge. I'm Leanne Moriello, Director of Lifestyle Medicine at Spectrum Health. Let me begin by saying that I have thoroughly enjoyed all of the plant-powered sessions this month, and so appreciate the involvement of all of our guest presenters. However, I must admit that this is a very special session for me personally, because our guest speaker today has had a profound impact on my career, educating, influencing, and inspiring me from early in my career as a behavioral scientist through his research, publications, and presentations. Every time I heard Dr. David Katz speak, it further fueled my passion and efforts to help people make successful and lasting health behavior change. I'm excited to introduce him to you and honored to participate in a discussion with him today focused on the impact of diet quality on the big three: chronic disease, COVID-19, and climate change. Before we get started, let me share just a few of the many accomplishments of Dr. Katz. Dr. Katz is a specialist in internal medicine, preventive medicine and public health, and lifestyle medicine, with a particular expertise in nutrition. He is a global thought leader and pioneer in lifestyle medicine, having served as president of the American College of Lifestyle Medicine, president and founder of the nonprofit True Health Initiative, and founder and CEO of Diet ID. And for over 20 years, he served as founder and director of Yale University's Yale Griffin Prevention Research Center, where he secured and managed roughly $40 million in research funding. Dr. Katz is the recipient of numerous awards for teaching, writing, and contributions to public health. He has over 200 peer-reviewed publications, has published hundreds of online and newspaper columns, and has written 19 books. He has an extensive media portfolio, having served as the nutrition columnist for the Oprah magazine, and as an on-air contributor for ABC News and Good Morning America. He is one of the original 150 influencers selected by LinkedIn and has a social media following of nearly 1 million. His career-long focus has been the translation of science into action for the addition of years to life and life to years, and is recognized by peers as the Poet Laureate of Health Promotion. I am humbled and honored to be with Dr. Katz today for this discussion centered on the topic of diet at the confluence of pandemics, COVID-19, chronic disease, and climate change. Dr. Katz, welcome, and thank you for being here today. Maybe we can begin with what's likely on the mind of many of our Plant Powered Challenge participants. How do they transition from the challenge to incorporating whole foods and many plants into their daily diet? Really taking it from a challenge to a lifestyle. And I'd love to incorporate, I was struck by your recent column titled "To Diet or Live It?" That is the question. And if you wouldn't mind, would even love to quote you from that article briefly. At the end, I believe you said, "This year, resolve to evolve your relationship with food. Let this be the start of what you find instead of what you lose. By all means, make how you eat a priority it deserves to be. Just don't diet, live it instead." Can you talk to us a little bit, Dr. Katz, about that advice and why you say diet is a good noun and a bad verb?
Well, thank you, Leanna. Yeah, I like that column. You know, you write something, and after you've written it, it's external to you. And I found over the years, I have this vast archive of columns, I can read them the way someone else would. And I like this one. I think it's important. It's a theme I've returned to many times over the years. Do we want to diet or do we want to live it? So, first of all, I also quoted in that column John Mayer, who has a great song, "Love is a Verb." So basically, my corollary to that is diet should be a noun. And what I mean is, when we use diet as a verb, it's I'm going to diet. It's dieting. And what that means is I'm going to temporarily deprive myself of what I really want to be eating so that I can blank. And blank could be, look good in a bathing suit or at a wedding or whatever it is, but usually a very short-term goal. So it's okay that I'm going to go on the diet, lose weight fast, and then go off the diet and gain it back just as fast, usually with interest. And I'm not going to do anything to improve my relationship with food so that I can love the food that loves me back. And living it is the alternative to that. So diet as a noun simply means dietary pattern, so my way of eating. And my goals here are to find a way of eating where I can love the food and the food loves me back by cultivating my vitality, my longevity. So it is about finding more years in life, more life in years, not about losing weight. If you need to lose weight, eating better will help you do that. And by the way, one of the things to emphasize in a plant-powered challenge is that one of the single best ways, Leanne, to lose weight without being hungry and miserable and feeling like you're depriving yourself is simply to trade up the quality of the food you're eating. And the single best way to do that is to emphasize whole plant foods direct from nature. There's a really big story to unpack there, and maybe we'll get into it later, but I'm tempted to talk about the work of Michael Moss, the fact that the food supply is willfully engineered to be addictive, but all that comes in processing. And all you need to do to reverse engineer that is move away from highly processed foods to completely intact foods direct from nature. But I love that. One of the many virtues of simply making wholesome foods a more routine part of your diet. So eating more vegetables, fruits, whole grains, beans, lentils, nuts, and seeds, and drinking water most often when you're thirsty. One of the many virtues of that is you absolutely will fill up on fewer calories so you can love your weight and not be hungry all the time. So again, it's really not about what you lose, it's about what you find. I think that the question of how best to make this transition from challenge to lifestyle. I was a clinician for 30 years before leaving clinical medicine to focus on my public health activities now. And my answer here, Leanne, is very much aligned to the answer that I gave individual patients, which is the best way for you to do that is the best way for you to do it. What's in the way? Is your particular challenge a significant other who doesn't want to come along? And maybe it's a bit of social engineering that has to come first. Is it kids who really, who've grown up learning to love junk food, and how do you wrestle with that? Is it you? Do you have a sweet tooth and you're finding it really hard to wean yourself off sugar? Do you love highly processed salty foods? And so, there isn't a need to personalize the specifics of this, but the general story is some of the world's greatest cuisines, like the diverse cuisines from the Mediterranean region, also happen to be among the best for health. They're plant predominant. They may not always be plant exclusive, but they're certainly plant based. I think of plant based as encompassing diets that are exclusively made up of or mostly made up of vegetables, fruits, whole grains, beans, lentils, nuts, and seeds, the really good stuff. All the diets that are best in the world have that in common, but those aren't the kind of diet that you do as a verb. It's the way whole populations have been eating for whole generations. And it's a way we are very happy to eat on vacation. We'll actually go to that part of the world, spend our hard-earned money to enjoy that food. That's how we should be thinking of this. So you're essentially looking for the sweet spot between what are my health goals related to how I eat, what are my preferences related to how I eat, and can I get help from experts like you, for example, so that I can maximize the pleasure I get from eating, maximize the pleasure I get from good health, and then why would I want to live any other way? Once I find that sweet spot, that's what it's about. So it's much more about the joys of good food and good health that you can find, rather than the sorrow of I'm going to fixate on losing a certain number of pounds quickly, and then I'm going to have to do it again and again and again because I've applied a quick fix to a lifelong challenge. This challenge, I think, is designed to help you make that transition from where you were before to where you really want to be for the rest of your life.
Yeah, thank you. I love that. I really love the focus on, what we can eat, what improves our health, what makes us feel better, rather than focusing on what we, shouldn't eat or isn't that great for us. But as you were talking, I was really reflecting on how our social environments, the world around us, that's not really the norm where a lot of us live and breathe here in the United States. And Dr. Katz, I've heard you speak a lot in the past about blue zones and naturally occurring areas around the globe where people kind of, like you're saying, live a lifestyle, live a diet that is naturally really health promoting. And in fact, in those blue zones, as I recall, individuals naturally, many of them live to 100 or beyond by just living this really healthy lifestyle. Can you maybe talk a little bit more about, what you've observed and learning about and experience about the blue zones, and maybe again a little bit for our challenge participants who are living here, many in West Michigan, not all in West Michigan because we have participants from around the globe, but for those living in an environment that's not supportive of everything you just talked about, there are certainly some challenges to doing what we can make sound really easy, but we know
Right.
it's not so easy.
Right. It's simple, but it's not easy. There's a big difference. Well, first of all, a shout out to my good friend Dan Buettner, who is the originator of the Blue Zones and the author of all those books. And for those who don't know, so the Blue Zones are defined as populations that have an unusually high prevalence of centenarians, people who live to be 100. And then when further explored and analyzed by teams from National Geographic, where Dan was a fellow, they found that not only do they live to be 100, but they live to be 100 in good health. They don't get chronic disease. They don't get heart disease, cancer, stroke, diabetes, dementia, all the scourges of modern epidemiology. It's a great thing to talk about because there are a number of lessons that come out of the blue zones. And we probably won't be able to enumerate them all, but let's hit some highlights. First, I think that the blue zones show us all how high is up. The blue zone's blessings are live long, prosper with vitality, and then ultimately go gentle into that good night. Friends, it doesn't get any better than that, right? So more years in life, more life in years, massively reduced risk of any major chronic disease. It's as good as it gets. So, we're really talking about the prize of vitality and longevity. And that's possible for all of us. We know and have long known that lifestyle practices can reduce our personal risk for any major chronic disease by at least 80%. And it's a very short list. You don't smoke, eat optimally, which is what we're talking about here, be physically active, 80% reduction in the lifetime risk of any major chronic disease, 80% reduction in the risk of premature death. So the blue zone blessings are potentially within reach, and the promise of it could not be more luminous. That's one message. Another important message is there isn't just one narrow prescription for how to eat or live optimally, because the 5 blue zones that have been identified to date all have high concentrations of people living to be 100. All are largely free of chronic disease, but they're quite different from one another. 2 of them are Mediterranean populations, Icaria, Greece, and Sardinia, Italy. So they have Mediterranean-style diets, plant predominant, but not plant exclusive. They're high in fat. They both emphasize olive oil, as an example. Another population in Okinawa, Japan, traditionally very low-fat diet, also not plant exclusive, but plant predominant, but a different suite of plants. So again, commonalities, lots of vegetables, fruits, whole grains, but the grains are wheat and barley in the Mediterranean, they're millet and rice in Okinawa. The Nicoya Peninsula in Costa Rica, where there's yet another very different kind of diet and a very strong emphasis on a particular locally grown tuber, but again, not plant exclusive, but plant predominant, whole foods, and intermediate in terms of overall fat content, but relatively low compared to the Mediterranean countries. So, and by the way, just a digression, I don't think total content of fat or carbohydrate is a good way to measure the quality of the diet. It's the assembly of wholesome foods in any balanced way. And then finally, Loma Linda, California. So we have one blue zone here in the United States, which is sort of amazing. I mean, in the midst of the world's epicenter of junk food, we have a blue zone. And this is among the Seventh-day Adventists, whose religious guidelines steer them toward vegetarian and vegan diets and eating whole foods and respecting their bodies. And so just like these other populations around the world, they routinely live to be 100 and don't get chronic disease. So on the one hand, the blue zone blessings are amazing. On the other, they are accessible because we can all learn those lifestyle practices. And they also showcase this is not just one narrow lane. It's a basic theme. And by the way, it's not just diet, of course. I talk about the Blue Zone blessings as 6 things: feet, forks, fingers, sleep, stress, and love. So feet is physical activity. They're active every day. It's not about sweat and spandex. It's about just being in motion, going for walks, basically activity on your way to the market to buy your groceries. Forks, obviously, is dietary patterns. They all eat very well. Fingers, avoiding toxins like tobacco, excess alcohol. Sleep, getting enough. Most Americans don't. Stress, not getting too much. Most Americans do. And love, which means social connections. And all love is good love. It's not just romantic love. It's siblings and parents and children and friendship. It's our social network. We need one another. John Donne said it best: no one is an island. We really need that. So the Blue Zones fire on those 6 cylinders of lifestyle medicine, and they reap the benefits. Live long and prosper with vitality. We all can, but it's not a narrow prescription. We have options. I think that's a beautiful thing. They do tell us another very important lesson, and that is we see Blue Zones where culture makes it easy to do the right thing. In other words, nobody in a Blue Zone is buying the new fad diet book. Nobody in a Blue Zone is thinking maybe I should try keto. Nobody in the Blue Zones living a Blue Zone lifestyle is thinking I better tune in to Good Morning America or the Today Show tomorrow to learn how I'm supposed to eat this week. They eat the way their grandparents ate, who eat the way their grandparents ate. It's rooted in heritage. I think that's really important. A lot of what we chase in modern culture is misguided. And then we do place too great a burden, and I'll tell all of you this quite frankly, the burden on you to eat well and be healthy is greater than it should be, because you live in a culture that actually conspires against your health. And if you want to get into it, Leanne, I would make the case, as I do in some of my books, basically conspires against your health for profit. There is a profit motive to make people fat and sick in America, and you are a victim of that. Is that fair? Totally unfair. Frankly, you should be outraged that corporate America essentially preys on you and your children to fatten their corporate profits at the expense of your health. I personally think it's unconscionable, but it is the reality we live in. And so the result is you need this. You need coaching. You need, yes, willpower, but more importantly, you need skill power, because to take the lessons and the blessings of the Blue Zones, where culture makes it easy to do the right thing, it's just the norm, and do it here where culture makes it hard, you need skill power. You need to be in the driver's seat. You need to take control. You can do it. And I truly don't think the burden should be as great as it is on you. But on the other hand, back to John Mayer, where all this started, we can't just keep waiting on the world to change. So until we manage to change our culture, the burden is on you and me, and it's our job to take good care of ourselves and the people we love, so let's learn how to do it.
Yeah, we try a lot at our lifestyle medicine practice to really foster the concept of changing in community, which is really what we're trying to do with this Plant Powered Challenge is, bring about 4,000 individuals this year, which we're excited about, together, kind of use our private Facebook group as a way to connect individuals and help them see that there is a community that can be behind them and supporting them, in addition to the health coaches and providers at our practice. So, fully agree. We need to build that community however we can.
I think that's fantastic. Yeah, culture ideally would be the whole culture. So, again, if you're in Okinawa and everybody eats well and is active and sleeps enough and isn't stressed out and has social connections, it's easy to do those things. But culture can start with a family. A family has culture. We're all familiar with that. We talk about family values. Those are elements of culture we share with the people who are most important in our lives. You can build culture there. Well, health can be a family value. Healthy eating can be a family value. Plant-based eating can be a family value. And in unity, there is strength. And then, yes, you can create a community of those small communities, and the next thing you know, you've got 4,000 people supporting one another in a wide variety of ways. I don't know what to do about this. Oh, I've solved that problem before. You're right, it's challenging. Here's what I did. It worked great for me. Thank you. I think one of the great aspects of what you're doing is you're empowering individuals and growing a community at the same time. So essentially solving this challenging problem at 2 levels. And I think that offers staying power, I really do. In unity, there is strength to go the distance.
Great. So today we're going to spend some time, I understand, to talk about diet quality and its impact on pandemics. COVID-19, certainly the pandemic on everyone's mind constantly, on every news source we might turn to, but also in kind of your wisdom, the pandemics of chronic disease and climate change. So we've kind of already begun a little bit on chronic disease, but I want to go a little bit deeper. But before we even jump there, can you talk to us a little bit about your use of the term pandemic for not only COVID-19, but for chronic disease and climate change? Because folks might not be, familiar with hearing the term pandemic applied to climate change
is
or
that
chronic
valid?
disease.
Yeah, so I have a good credential. I'm going to play that card. I've co-authored 5 editions of a leading textbook on epidemiology and public health. So I guess I'm allowed to make use of epidemic and pandemic in ways that I think make sense. Yeah, I mean, essentially an epidemic is when something impacting human health is occurring at an unprecedented level. It doesn't necessarily mean a whole lot because, for example, if we had one case of smallpox in the United States, since we've eradicated it completely, one case would be an outbreak or an epidemic. So it's really a departure from what's expected and normal, and it's impacting human health. A pandemic is an epidemic affecting the whole world at the same time. Well, chronic disease is pandemic. We have rising rates of obesity, type 2 diabetes, and cardiovascular disease in developed countries all around the world. Those levels just keep marching up year after year and occurring at ever younger ages. The United States is arguably the epicenter of this, but all of Europe is affected, major parts of Asia are affected, again, essentially every industrialized country around the world. And that's a pandemic. And then climate change is, frankly, the true existential threat of our time. The COVID pandemic, which we'll come to in a minute, we all know how bad it is. We don't need to talk about it, but it will end. Acute infectious disease pandemics ends. Right now, while we're near the end of a 2-year experience, it feels interminable. But ultimately, history will look back at these 2 years and will be inscribed as a brief story, just like the 1918 pandemic. Up until now, how many of you knew the details of the 2 years of the 1918 flu pandemic? It's a footnote somewhere. It happened. It's as if it was a light switch. It was on, it was off. We didn't really think about what was it like to live through those 2 years. Well, now we know. Feels like it's forever, but it's not. It will end. But it will never end if we so abuse our planet that it can no longer feed us and sustain us. That will never end. That's not a problem we can recover from. So what we're doing to the planet, climate change, resource depletion, rising seas, rising levels of carbon in the atmosphere, melting glaciers, declining aquifers, on it goes, that's a pandemic problem. It is a new and unprecedented threat already imposing health burdens on human populations. There's a great book by friends and colleagues of mine, Dr. Sam Myers and Dr. Howard Frumkin, called Planetary Health, Protecting Nature to Protect Ourselves. These are physicians who point out we are already experiencing elevated burdens of many health problems because of what we're doing to the planet. It's not indirect. We hurt the planet, we hurt ourselves. That's pandemic. So diet is absolutely at the confluence of all three in a whole variety of ways. Let's first talk about chronic disease, just to quickly revisit that. So my journey in public health, lifestyle medicine, began when I finished my training at Yale in preventive medicine in 1993, almost 30 years ago. And that year, in the Journal of the American Medical Association, a paper came out called Actual Causes of Death in the United States, and it looked beyond the causes of death that are inscribed on death certificates, heart disease, cancer, stroke, diabetes, and asked the question, what caused that? And just to cut to the chase here, the three leading causes of all of that, responsible for 80% of the burden, were bad use of feet, forks, and fingers, lack of physical activity, poor dietary patterns, and tobacco was number one. Jump ahead to now, because we're smoking less and because our diets are still quite terrible, diet is number one. Let me state this as emphatically as possible. Diet is the single leading risk factor for premature death and chronic disease in the United States today. This was true before COVID, Arguably, it's true even during COVID, and it will certainly be true after COVID. So there's the argument about, yeah, you should focus on your diet if you want to protect your own health. What about COVID? Well, first of all, major risk factors for adverse outcomes in COVID. COVID is not a one-size-fits-all threat. If you're healthy, and if you're young, if you're relatively young and healthy, so under 50 or 60 and healthy, you're very unlikely to be very badly hurt by a COVID infection. Most of the really grave toll of the pandemic, as we all know and have experienced, is in older people and people with prior illness. Well, much of that prior illness is diet-related and lifestyle-related. It's cardiometabolic disease. It's obesity, hypertension, dyslipidemia, type 2 diabetes, and so on. Some of it's tobacco-related lung disease. But essentially, it's lifestyle-related conditions that make us vulnerable to bad COVID outcomes. So indirectly, we could implicate diet and say, okay, so it's a major part of the toll of the current pandemic. But we can go a step further. We can implicate it directly. There was a paper a few months ago in the British medical journal imprint Gut, looking specifically at variation in diet quality measured objectively in a large population and COVID outcomes. Did you get hospitalized, yes or no, when you got infected? Did you wind up in the ICU? Did you die? And they found a very strong correlation between diet quality and COVID outcomes, matching for other variables. So matching for weight and blood pressure and so forth. If your diet quality was high, you were much more likely to recover uneventfully. If your diet quality was low, you were much more likely to wind up in the ICU on a ventilator or die. So even during the pandemic, there's an acute effect of diet. And then finally, the issue of the planet, because we cannot live without one. And I would argue, Leanne, this is a very important consideration as we're talking to one another about the value proposition of moving toward plant-based eating. I look at diet through three lenses. Even though I'm a physician, I don't just think about acute effects, direct effects on human health. That's important to me. That's lens one. I also care about how we treat our fellow creatures. Three of my best friends on the planet have 4 legs apiece, 2 dogs and a horse. I think the way we treat domestic animals to produce food is utterly unconscionable, and I don't think any decent person wants wanton cruelty on the menu. We need to know about that and say, okay, that doesn't mean all meat eating is wrong, but certainly abuse of animals is wrong. The kinds of things that happen on factory farms is wrong. I don't want to participate in that. So I need to think about how I eat so I'm not participating in that. I think that matters. I really do. That's lens 2. How does our selection of a dietary pattern play out in terms of how we treat our fellow creatures who have as much right to be here as we do? And it's both wild animals and domestic animals. And then the third is, what is the environmental footprint of our diet? How is it expressed in terms of greenhouse gas emissions, water utilization, land use, and so on? When you look through all three of those lenses, the view very clearly is of, if not a plant-exclusive diet, so whole food plant-exclusive, it's as close to that as you're willing to get, no question about it. I think there's more debate when you just talk about human health, which is better, plant-exclusive or a Mediterranean variant. We really don't have the studies to say one produces more 100-year-olds than the other. We have blue zone versions of both. But if we're thinking, I want to minimize my impact on the environment, I want to maximize my kindness and gentleness to my fellow creatures, and I want to optimize my own health, plant-based eating all the way. Plant-exclusive eating clearly makes sense in that regard. In addition, one final point, we could keep going, but I want to bring this to a close. There's a lot of focus now among my colleagues in biodiversity, conservation, ecosystem management, rainforests, and so forth, about the fact that the origins of pandemics involve our incursions into natural ecosystems, often in pursuit of meat. And there's still debate about how SARS-CoV-2 emanated out of Wuhan. The original thinking was a wet market. There's been debate about whether it was a lab leak. But most signs would suggest it was a wet market. What's a wet market? It's basically a market that's trading in bushmeat. In other words, people are eating wild animals. And so there are bats for sale and exposure to other wild animals. We're doing that because we don't have a sustainable, reliable, humane alternative food supply readily available to all. Achieving that is one of the things we need to do as a globally coordinated effort if we want to avoid the next pandemic. I mean, after having just made it through these interminable 2 years and hoping this thing ends very soon, we sure as heck don't want to be doing this again anytime soon. The way we eat is at the very origins of pandemics. Eating less meat would be the single most obvious thing the world could do if we want to turn off the next pandemic before it gets started. So the implications just go in every direction. So I like to talk about, because we're obviously so preoccupied with the pandemic we're living through, I like to talk about diet at the confluence of several pandemics. And in many ways, it's actually good news, because you may feel helpless about preventing the next pandemic. You may feel helpless about climate change. And you may think, well, the only thing I can really do is try to take better care of myself and my family. Well, the good news is if you take hold of this matter by what you do with your fork every day, you can play a role in all three.
Wow, that's powerful. Yeah, and listening to you, Dr. Katz, it's like overwhelming, all the benefits, right, of having a high quality diet. And as we were talking about at the beginning, it seems like it should just be so simple and easy. And we know a lot of individuals are starting from a point, even individuals in our challenge. We really encouraged folks to enter who were curious about learning more, about building skills, about adding some more whole foods and plant-based, not going, to exclusive whole food plant-based eating. And so as you were speaking, I was thinking about, for individuals listening right now that may be pretty far from a whole food plant-based predominant diet, where do they begin? But it seems like maybe you've just answered that by saying maybe starting by trying to reduce or eliminate meat.
I think that's a great choice. So a couple comments. First, I think we really do need to systematically differentiate, Leanne, between simple and easy. I have a story I told in one of my books. I think it was Disease Proof. I'm an equestrian. I have a horse. I love to ride. I took riding lessons for many years. And one of the things my riding instructor, Sue Horn, told me was, it's simple. That doesn't mean it's easy. And what she was talking about, situating yourself properly on a horse jumping over fences. Basically your legs need to be here, your arms need to be here, your balance needs to be here, you need to use these. It's simple. Doing it takes years of training. And I would argue in a society that profits massively from turning junk into food, or more accurately, putting junk where food ought to be and peddling it to you, it's anything but easy to eat well. It's still simple, because the formula, Michael Pollan expressed it in 7 famous words, right? Eat food, not too much, mostly plants. Boom. Really, really simple. I wrote a book called The Truth About Food, 200,000 words. And I joked about the fact that actually this book should be 7 words and they should be plagiarized because they're not mine, they're Michael Pollan's. That's the truth about food. Why did I need an additional 199,993 words? That's because it's not easy. So it was to explain, here's how you get there from here, here's what's in the way, here's what you have to overcome, and on it goes. So huge difference between simple and easy. And I think it's really important that we emphasize that eating an optimal diet in a culture that conspires against it really does put a significant burden on you. You need skill power. That's not overwhelming. It's doable. Think about all the things that you rely on in your life that you had to learn how to do. Reading, counting, math, riding a bike, driving a car. All this required skill power. You learned how to do it. And when you were learning, it was difficult. But then you learned, and it was a skill you could benefit from for the rest of your life. I would argue that healthy eating, healthy living is just like that. And the work you're doing makes it possible to acquire those skills, right? Culinary medicine shows you, here are recipes you can make at home. They're simple, easy, delicious. You can do this. And you're empowered then to say, I've got new skills, so I can practice this at home. So, again, simple, yes, easy, no. But the value proposition of moving toward more plants overall, very, very high. But yes, I completely agree that the single easiest decision you might make that's better for you, better for our fellow creatures, better for the planet would be, if you eat beef, eat less beef. However much you eat less, cut it in half. If you eat it every day, don't eat it every day. Eat it every other day. If you eat it once a week, cut that in half. If you eat it at 3 meals a day, stop eating it for breakfast, and ideally stop eating it for lunch. Be, if you will, vegan before 6, as Mark Bittman wrote about. And the reason for this is a number of things. First, if you, say, substitute plant-based protein sources like beans for beef, massively better for your health. Is that because of the saturated fat in the meat? Or is it because of the animal protein in the meat? Or is it because of the fiber and phytonutrients in the beans? Yes. In other words, who cares? The active ingredient in beans is beans. I mean, there's a lot of stuff in there. So it's both what you're taking out of your diet, stuff that you get too much of and don't need, and what you're putting into your diet, stuff you get too little of and do need. The wholesale substitution of beans for beef means massively significant health benefits for you. In addition, if the world stops eating so many hamburgers, we'll stop having so many factory farms that torture animals. I hate to be so blunt, but that's exactly what they do. And in terms of environmental impact, the single most actionable thing for all of us would be to eat less beef, because massive contributor to greenhouse gas emissions and climate change, massive consumption of water, off the charts compared to even the next highest food, which would probably be swine and sheep. So other animal husbandry is next in line. So animal foods are all off the charts relative to plant foods for the most part, but beef is an order of magnitude greater than the next single offender in terms of water utilization. So if we want to save our aquifers, help stabilize our climate, stop abusing animals, and save the rainforest. That final point, through my nonprofit, we're actually working on a global 1-week challenge. We're targeting this for April of 2022. No beef this week. I don't know if people realize this, Leanne, but of course, deforestation in the Amazon. I mean, one of the great, magnificent icons of nature, the Amazon rainforest. Can you imagine an Earth without an Amazon rainforest? It boggles the mind, but that's what's happening. And it's very easy to say, well, the Amazon's being burned down and turned into pasture land because Brazil has a crazy president. And frankly, Bolsonaro is a nut. But the fault lies with us. It's the global demand for hamburgers, because that's what makes it profitable to burn down pristine rainforest, to graze cattle, to feed that global appetite for beef. So what the True Health Initiative is calling on the world to do, 1 coordinated week, no beef. Of course, you can't help because you don't eat beef, and I can't help. So we're calling on people who do eat beef that week. So visit truehealthinitiative.org to learn more. That week, don't buy beef, don't eat beef, and say, it's not that I'm not necessarily giving up meat for the rest of my life, but I do not have an appetite for hamburgers at the cost of the Amazon rainforest, too high a price, right? I think the whole world should be able to rally around that. But that's the power of eating less beef. You're actually helping to save pristine rainforest. You're helping to preserve the climate. You're helping to preserve aquifers. You're helping to be kinder and gentler to our fellow creatures, and you're doing your health a giant favor. So absolutely, if I'm going to pick one swap, I'd say eat more beans and start looking into fabulous recipes. There are all sorts of things you can do with beans and lentils. And of course, you do a great job of teaching people cooking and recipes. I rely on my wife, who's a brilliant cook. On her recipe site, Quizinicity, so maybe we'll post a link to that, Leanne, quizinicity.com, freely available to all. Katz Family Greatest Hits. She's produced the world's greatest vegan burgers. Now, do I actually know that? Have I tasted every vegan burger in the world? Yes. No, I probably haven't. But I've had a lot, and I mean, they're just fantastic. And it's a beautiful demonstration of how you can have your plant-based diet and eat it too. I mean, basically, you're eating something that's delicious and luscious, but it's beans, not beef. Better for you, kinder, gentler, better for the planet. Delicious and satisfying. Does it get any better than that?
Yeah. Well, Dr. Katz, I love the perspective that you're bringing today and bringing to the challenge, linking diet quality to climate change, because I think it's something that's, not as maybe obvious to everyone, and just such new, good wealth of information. And, as you're talking about your wife's, vegan plant-based burgers, and I can just, imagine how delicious they are. And certainly, it's our passion is teaching how to make health-forward food, easy to make, simple, easy to make, delicious, low cost. We love building skills and helping people really embrace home cooking. But we know it's not for everyone. We know that even, the best cook doesn't have enough time 365 days a year to cook. So maybe to go back to your challenge coming up, did you say in April around Meatless Week, for for people who are entering in a really kind of early stage of improving their diet quality with not a lot of maybe confidence or skill building yet in the kitchen, would you even go so far as to recommend a substitute for what we call a transition food, like an Impossible Burger or a Beyond Meat Burger, or something that, reduces, use of meat as a transition period, perhaps?
Definitely. I think that's the huge value of those foods. I mean, for some people, it may be a part of their diet long term. For many, I think it is a gateway drug to plant-based eating, right? So the idea is, I'm a carnivore. I like meat. I eat meat. Not me. I'm playing a role here, but imagine that's me, and I know it would be better for me to eat less meat, but I love it, and I know it would be better for the planet for me to eat less meat, but I love it, and so you're basically asking me to give up what I love, and I don't want to do that. And here comes the answer, courtesy of modern technology. We can produce something that tastes and feels just like that meat you love, but no animals were harmed, much reduced environmental footprint. Okay, that sounds great. Is it better for my health? Well, actually, we're not sure because we really have limited science on that topic. But we have no reason to think it's worse for your health because that wasn't good for you to begin with. So, it's funny. I look at these alternatives, Beyond and Impossible, and there'll be many more. And I've been asked this question many times, and I've written about it. And it's very ironic that the final current word on the topic of meat alternatives is courtesy of a guy named Meatloaf. 2 out of 3 ain't bad, right? So you remember that song from Meatloaf. Is it better for my health? Not sure, maybe, but probably at worst it's a lateral move. Is it better for my fellow creatures? Oh yeah. And is it better for the planet? Oh yeah. 2 out of 3 ain't bad. And then in terms of that third, I'm with you. My hope is, okay, so here's a way for me to shift to plants and still satisfy my palate. But I'm a very strong believer, Leanne, in something that years ago I started calling taste bud rehab. Taste buds are adaptable little fellas. When they aren't with foods they love, they learn to love the foods they're with. If you eat junk all the time and that's what's familiar, it's what you prefer. If you eat meat all the time and that's what's familiar, that's what you prefer. If you shift to meat alternatives, that's a lot like meat, but it's not meat, you're probably starting to take your taste buds on a journey where they might be willing to say, okay, I'm willing to try a veggie burger or a vegan burger, or maybe even just eat a bean salad, and you're on your way. So yes, I think they're of intrinsic value. I think it's a great opportunity for us to convert more people because, let's face it, you don't need a plant-based challenge for people who are already eating plant-exclusive diets. I mean, maybe some of them need to improve the quality of their diet because it's certainly possible to have a vegan diet that's poor quality. But by and large, a plant-based challenge is for people who weren't eating plant-predominant diets to begin with. So what are they eating instead? They're eating meat and animal products. So that's who we need to be talking to here. Folks, I assume that there are many of you in the mix. So this is absolutely for you. It says, this is a flavor profile and a texture profile you're used to and you like. Okay, we can satisfy it, and your journey can begin here. And I like breaking down what is not an easy task, simple yes, easy no, into steps that are easy. And I think swapping out your beef burger to try Beyond or Impossible's offering, that's easy. Go for it.
Well, maybe we can transition back for a moment to the COVID-19 pandemic. And I know we're all exhausted by the topic, but I wanted to have the opportunity to ask you a little bit more about, you mentioned the study looking at the link between diet quality and outcome with COVID-19 and you talked about that high-risk group of individuals that are older and maybe already have chronic disease that may likely already have a long history of poor diet quality. What would you say to that group of individuals? Certainly probably have some in our Plant Power Challenge. Is all hope lost? Can making some changes now help them even deep in the midst of this pandemic? So what would you speak to maybe that high-risk group that doesn't have that ideal diet quality? Can changes now help them in relation to COVID-19? And, how much change would be needed maybe to help them?
That's an excellent question, Leanne. The audience should know, and, any of you who read my writing will know this already. Those of you who don't, sorry to disclose this. I'm a COVID curmudgeon. I think we've sort of mucked up everything. And I've done a lot of griping in my columns and video commentary about how we've handled all of this. But the single greatest failure from my point of view relates to what you and I do. we advance the incredible, luminous value proposition of lifestyle medicine, and it's been systematically neglected in the pandemic. We never said, and we've been in this for 2 years, a major reason why this is hitting America so hard is we were awash in type 2 diabetes, hypertension, dyslipidemia, obesity, heart disease before this came to our shores. There's never been a better time to get healthy together. Let's have a national campaign. Let's have state campaigns. Let's get everybody and anybody involved in making it easier to eat better, be active, improve our health, because absolutely that will fortify us against the acute threat of COVID. We've had 2 years to do it. We still haven't done it. It's a shame. So you participating in the plant-based challenge, is it too late for this to benefit you? Absolutely not. So, it's certainly never too early to start using lifestyle as medicine to optimize your diet. And the earlier you do it, admittedly, the greater the lifelong benefits, because those benefits are aggregate, right? So every year you're eating optimally is another year where your body reaps those benefits. But it's never too late. And I think one of the incredible value propositions of eating well that's overlooked is the immediacy of certain effects. With regard to COVID, there are two key elements. One is, what does the quality of a meal I eat today do to my vascular health? Why does that matter? Well, we've identified that one of the targets of SARS-CoV-2 is the endothelium. It's the lining of blood vessels. It's the reason why early in the pandemic people were having strokes, they were forming blood clots. It's a target area of the virus, and it causes damage throughout the body. Well, endothelial function is affected by food. And you can alter endothelial function. I'll spare you the details of how we measure it. You don't need to know. But suffice to say, we're looking at the responses of the lining of your blood vessel, whether they're healthy or not. Well, you can make them healthy immediately by substituting a high-quality meal of plants for a low-quality meal of junk. You measure endothelial function in the hour and two following those two meals, and it's night and day. We've done this. I ran a vascular lab for years. We published many papers on endothelial function. These were the kinds of tests we ran. So a single meal can alter your vascular health, and your vascular health is a huge part of your defense against COVID. Now, is one good meal as good as eating well for a week? No. Is eating well for a week as good as eating well for a month? No. So in other words, the longer you stick with this and the more complete the transformation you make, the more you fortify yourself, both against chronic disease and against the acute threat of COVID. That's just one pathway. The other pathway is something called chemotaxis. Chemotaxis is a study done in cell culture where you take an antigen, something that stimulates an immune response, and you harvest white blood cells from someone's blood and you expose them to this provocation, this stimulus. And you basically are able to measure how quickly do white blood cells respond to what they ought to perceive as a threat. A junk meal, a meal of junk where food ought to be, impairs chemotaxis. So in other words, your white blood cells are actually sluggish. Your inner defenders against SARS-CoV-2 are weighted down by junk food. They don't respond as well. Substitute a high-quality meal, vegetables, fruits, whole grains, beans, lentils, nuts, and seeds, the usual suspects. It enhances chemotaxis. And again, this is immediately postprandial, the period right after eating that meal. We're not talking about how this effect builds up over a lifetime, a decade, a year, a month, a week, or even a day. We're talking about in the 2 hours following a meal. If you ate a high-quality meal, your vascular function will be better and your chemotaxis will be more robust. And if you ate a meal where junk displaces food, your chemotaxis will be impaired and you'll have endothelial dysfunction. It's huge. So, never too late. Never too soon, never too late.
Yeah, it's powerful, right? And I mean, it's one of the, I think, the most gratifying and uplifting messages we can bring to patients at our lifestyle medicine practice is the power that diet has to mitigate disease. And we talk a lot about this challenge being open to individuals who were curious about, whole food plant-based eating and those that were, committed or be ready to become committed. And maybe for a minute we can talk to kind of that group or that audience of individuals who are either committed or really close to committing, particularly after maybe, hearing your words and wealth of knowledge today, hearing even more about the power of diet quality. And individuals who are curious about the ability for diet to even reverse disease. So for example, this year, our book for the Plant Power Challenge is Mastering Diabetes. And so we have a lot of patients too at our practice that come in with either, years under their belt of chronic disease such as diabetes, maybe new onset, but that notion that disease could actually be reversed with, again, maybe not incremental, but more extensive lifestyle change, more extensive, changes to improve diet quality. Can you speak a little bit from your perspective as a clinician, from what you've seen, from what you know about the power of diet and lifestyle to maybe not always, but in some cases actually be able to reverse disease processes?
Absolutely. And I speak here, as you know, Leanne is a past president of the American College of Lifestyle Medicine, and that's what we do. We basically advance the proposition that diet and lifestyle can be used to prevent disease, to manage disease, and to reverse disease. And so first, if that sounds far-fetched to you, right? Food is medicine. It's that powerful. It can reverse diabetes and heart disease. It's been proved, so it's not really debatable. The Diabetes Prevention Program has proved that diet and lifestyle can prevent the development of diabetes in high-risk individuals. Other studies have shown that type 2 diabetes can be reversed with high-quality diets. Dean Ornish, among others, has shown that an intensive lifestyle program with diet as the centerpiece can regress coronary atherosclerosis and is actually reimbursed by Medicare and Medicaid as an alternative to coronary artery bypass surgery. So you're having chest pain, you have advanced coronary disease, you need to fix it urgently. You have two choices. You can have surgery, or you can have lifestyle as medicine. And lifestyle as medicine works as potently as coronary bypass surgery. So not debatable. But I think the first thing to wrestle with here is you're probably skeptical. How can food be so powerful? Well, I would flip that around and say, how could it not? Food is the literal construction material your body uses to replace the worn out parts of you every day. Now, as a child, it's fairly obvious. A child's growth, it has to be made out of something. In nature, you can't make something out of nothing. So what's the something as you watch your son or daughter grow that they're building that additional part of themselves out of, that additional height, that additional weight? Food. Food is the construction material for the growing bodies of the children you love, period. Would you build anything you care about out of junk, let alone the things you care about most in the world, your beloved children? So the idea that we would cavalierly use junk where food ought to be for children, I think is kind of crazy. So if we're building ourselves out of food, kind of stands to reason that every aspect of health would be profoundly influenced. But what about us grown-ups? We're not growing vertically. Our only risk is growing in the other direction. Well, we are replacing hundreds of millions of spent cells every day. Blood cells, skin cells, the lining of our intestine. We're replacing used up proteins, hormones, components of cell membranes. Our bodies are like the flow of a river. We're never exactly the same 2 days in a row. Everything needs to be replenished. Where does that construction material come from? Food. When you hear the expression, you are what you eat, it's literally true in the sense that food provides the construction material for your body. Now, your body is amazingly resourceful, and it does the best it can with what it's got. So if you have an imbalance of fats and proteins and so forth, it'll still build cells, but actually the composition of cell membranes will be altered in correspondence to your diet, and they'll be weaker and more prone to leak and less functional. If you have an optimal supply of construction material, you build better stuff, and the same is true of your diet. So when you understand that, the idea that diet is powerful enough to reverse disease doesn't sound far-fetched. Actually, you start to wonder, how could anything else be powerful enough to do it? Now, will diet and lifestyle always reverse disease? No, it depends on a couple things. It depends on you. It depends on how far advanced the condition is. So, there's a point at which, for example, you've had coronary disease for decades and it's calcified and it's never going to go away completely, but you can still significantly improve your health, reduce the risk of acute events by eating optimally. So again, as we were saying before, never too late to derive a benefit, but the magnitude of the benefit will depend on where you are in the spectrum of any given condition. But the other thing that's dependent on you is how far are you willing to go. Most of us would argue that if you have a serious advanced condition, excuse me, such as heart disease, where there's a question of you needing bypass surgery, you're facing the prospect of a pretty dramatic intervention, right? I mean, having your chest opened up and your coronary arteries bypassed, it's a big deal. So your motivation to improve your diet is probably a little greater than somebody who's just thinking, I'd like to feel a little better, have a little more energy, right? So I think it's reasonable to say the same diet is optimal for both of you, but the person who just wants a little more energy, if they take 2 steps in the right direction, we can pat them on the back and say, good enough, better than nothing, it's the start of your journey. But you need to go all the way and take 10 steps because your alternative is bypass surgery in a week. So I think we have to embrace that notion. When we're using food as medicine, we're talking about making the intensity of that medicine match the severity of the condition. So it's the same prescription, actually. The same diet is good for promoting health, preventing disease, and reversing diabetes, heart disease, and so on. But the urgency varies, just as it does in the use of other medicines as medicine or surgery.
Well, wow, Dr. Katz, thank you so much. We covered a lot of ground today, covering pandemics from COVID-19, chronic disease, climate change. And I shared at the beginning as I was introducing our session that I had the honor and privilege very early in my career to hear you speak multiple times at conferences, and what an influence it's been both on my professional and my personal life, as you alluded to, trying to live a very health-forward life for myself and for my family. And just want to thank you from the bottom of my heart for bringing your knowledge, your perspective, and in such a compelling way to our Plant Powered Challenge participants today, and really sharing with them the power that their diet quality can have, particularly if they embrace it as a noun and not a verb.
Well, Leanne, absolute pleasure to be with you. I very much appreciate your kind and gratifying words, and knowing that I've had an influence on someone like you is a source of tremendous pride.
I would like to end by thanking each and every one of our roughly 4,000 Plant Powered Challenge participants. Thank you for joining the challenge, being so engaged in the virtual sessions, and thank you to the close to 2,000 of you who also joined our Spectrum Health Lifestyle Medicine Facebook group. I have been uplifted and inspired to read so many comments from our challenge participants, sharing why they joined, what their goals are, and also by reading the many comments from existing and new members about health transformations they've achieved by eating plant-based. I love seeing members share tips and strategies for making plant-forward eating not only possible, but also fun, easy, and delicious. Please continue to stay connected with us through the Lifestyle Medicine Facebook group and by reading our monthly e-newsletter, which highlights our current culinary medicine program offerings, as well as offerings within our medical specialty practice. The Plant Powered Challenge would not be possible without the dedication and tireless efforts of our Lifestyle Medicine team, particularly Elizabeth Suvetti, Sonia DeWeese, and Brigitte Shapton. We also want to appreciate and thank the involvement of so many guest speakers who volunteered their time, some even willing to brave it and cook alongside our expert Chef Elizabeth. And it certainly would not be possible without the sponsorship of Spectrum Health. Thank you to Tina Fries-Decker and the entire Spectrum Health executive team for your commitment to supporting health and for investing in lifestyle as medicine for our community and beyond. I hope the knowledge and skills you learn through this challenge carry forward to guide you in making meaningful and lasting improvements in the quality of your diet. I hope to see many of you in our other programming and practice offerings throughout the year, and again next year for another January Jumpstart. Until then, be well and eat well.